numb hands waking up in the morning, cervical headaches, hard to work overhead, like anything overhead. I have a very hard time tipping my head up, even driving, like, left or right, try to look, like this. Just a pinch, drying my hair, pinch, anything that I would do overhead, just in so much pain,
You see, what Mr. Schmidt has is degenerative spine disease. He has run-of-the-mill arthritic change, wear and tear that you and I experience from just going through life, working hard, playing hard. But once the degenerative disease gets to the extent that it starts to injure a nerve in the neck or back, now we run the risk of actually declining in our overall neurologic function.
My wife's a registered nurse, and she just basically said, look, if you're gonna have this done, we really got, this was when I had my back done in 2012. If we have this done, we really got to do some research, because I don't want you, having so many issues. So she went on the web and found Dr. Kremer. So we made an appointment. It was very easy to get in. He said all you need is an MRI and an X-ray of the affected area. Bring that in. He'll go over the information with us and tell us what the best course of action is.
When I showed him the options, one of which included surgery, he was able to go home and review online and watch some of our videos, and he became a lot more comfortable with the idea of fixing the underlying cause. He had a 2-level cervical fusion. The beautiful thing about neck surgery is that we can access the disc space directly. It's right here.
What was kind of cool about Dr. Kremer is he doesn't talk above, the lay person. He keeps it simple. They're titanium spacers, basically, that take up the space of where your disc is supposed to be. I got my height back, by the way. And so he basically went through this small incision, which I'm very surprised it's this small, and was able to clean out the bone spurs. 3 areas. I think the surgery, I was there at 7:30. Their surgery started at 8 or so. I was done by 10:30 and was home by 2. No pain meds, nothing. There's no pain there anymore. There's no snapping, there's no pinching, gone, no more numbness. No, and one more thing, I had cervical headaches, those are gone. And I also had sinus issues, nothing. I've been working on replacing some of the siding and replacing some of the trim work on my house. Did soffit work and up over the head work. No issues whatsoever. No pain afterwards. I can breathe better. I can eat better. Swallow better. Everything's just, it's amazing what was done just by, this is somewhat invasive, but for what they did, it's pretty extensive. Dr. Kremer's just, I don't know, I told these guys, I said, if he moves, I have to move with him, because I know I'm going to continue to have this issues till I'm gone. And it's hard to trust somebody, but he's 4 for 4, 3 here in my lower back. So as far as I'm concerned, he's hit a home run, The other nice thing is I can actually hold my grandson for longer than a couple of minutes without having to put him down, so that's kind of cool.